Yep. She's wearing purple, so
You all are poor, unfortunate souls. Sit down and behave.
Oh, yeah, the roll.
Don't
Get our credit. I wanna give y'all credit for being here.
Ooh, Ursula and my icon is over.
Alright, we've got 20, is that everybody?
Yes.
Raise your
Is there
hand.
20 of us or is there 21? Oh, there's 19.
just you and.
Okay,
Just 20.
just make sure you sign the roll before you leave.
Carry on.
Alright, select all that apply. What are surgical risk factors? Select all that apply.
Sorry. I get too competitive. Now I'm gonna show.
So that was the first question.
You know that select all that apply, even on your test and exam soft, you may select all of them or none of them. So don't be tricked into thinking, I need to feel like I need to select one of these at least, but it needs to be all or none. So yes, all of these are surgical risk factors.
Oh, am I being registered?
This is used when patient transfers from one peri-op area to another to relay care information. Yes, handoff of care. Alright. Type of surgery that removes tissue for cure.
Oh, I clicked the wrong one.
It's okay, girl.
Yes, ablative. We're taking out some tissue, fix the problem. An ASA 6 patient is having what type of procedure?
Come on, people, think. Think.
Yes, they're having a procurement. The ASA 6 patients are brain dead. This type of medicine causes adrenal atrophy that reduces the body's ability to withstand stress. Yes, corticosteroids. Y'all are so smart.
I'm not, it's okay.
Okay, glycemic control will be achieved by carefully titrating this medication during the perioperative period. Yep, insulin, you are correct.
We know
All
this.
about that one. We all.
This test grade's gonna be better.
An emergent surgical patient had a full meal 1 hour ago. Which nursing diagnosis takes priority? I know we didn't talk about nursing diagnosis, but just use your reasoning skills.
Who didn't answer?
Yes, risk for aspiration, that is correct. Who is responsible for informed consent? Yes.
Oh, y'all was quick that
The physician,
We'd like to put
yes.
blame somewhere.
Yes. Hair should be shaved from the surgical site to prevent infection. false. The hair does not have to be removed from the surgical site, and if you are gonna remove it, it needs to be clipped instead of shaved.
Hold please before the next
Because you
question.
can have micro abrasions from shaving, which sets them up for infection.
Shaving used to be the same thing.
It did.
Old school.
Select all that apply. Who is responsible for the timeout? Yes, everybody in the room.
I put everybody in there. Rewind. Yeah,
Everybody in the room is responsible, and the surgical technologist should not hand that scalpel to that surgeon until timeout is completed. Everybody is supposed to stop what they're doing and listen to the timeout. That does not always happen, but that's supposed to happen, okay? Select all that apply. Required articles, I'm having trouble talking. In semi-restricted zones of surgery. What do you have to have on in the semi-restricted zone of surgery?
Man, I probably got that wrong, because one of them, they required this morning.
Yep, just scrubs and a cap. Remember that's semi-restricted. Restricted would be that you would need your mask on also, and shoe covers, if you're smart. The sterile field remains sterile if
The surgeon said.
that is correct. Only sterile items come in contact with it. The yellow one, the field becomes wet, but the solution is sterile. If your sterile field is wet, it is not sterile anymore, because is the table up underneath sterile?
No.
No, and what happens if it gets wet?
It would.
Yes, it pulls that bacteria up through that drape. So always, even when you're setting up your sterile fields, like your Foley and your, dressing changes, whatever it may be, then you have to have fluid. If your field gets wet, it is contaminated, okay? Even if it's just a drop. Select all that apply. Steps for preventing wrong procedure site. Yes, everything except patient labels. Timeout, site marking, and handout communication. Patient labels doesn't mean anything. It could be the wrong labels on the wrong chart. The armband is what's important, okay? Those patient labels don't mean
I guess
anything.
that's what I was considering. Patient label. Yeah, an armband as a patient, because there's patient label usually.
Type of anesthesia used when a patient loses complete consciousness and reflexes. Yes, general anesthesia.
I am smart.
Correct.
You are, girl.
Severe surgical complication that is often hereditary.
Again.
Mine keeps coming up and I'm like 100 points behind there.
Woo,
Yes,
17.
malignant hypothermia. So you people that pick your pots here are trying to make me have a heart attack, aren't you? As much as I talked about pulling the hypothermia.
I'm right behind you, come on. I'm coming up.
Select all that apply. Triggering agents for malignant hyperthermia.
I'm cheating.
Yeah, acetylcholine and inhalant gases. Y'all got that. Good job.
Cheating is sometimes the enemy.
Phew.
If you're not cheating, you ain't trying.
Drug for the treatment of malignant hyperthermia.
What we got? You better be glad I know my shapes.
Yes, dantrolene or
What,
dantrolene.
that flexing?
Did I put that? What did I put?
Alright, Haley's leaving. Position used for many gynecological procedures.
Check.
I almost put my leg
Yes,
into
you
it.
You're
gonna demonstrate.
Please don't demonstrate. Please don't. I don't wanna hear about it later.
She's obviously had children.
What is this position?
Oh, wait, I didn't.
Yes, that's Trendelenburg.
I'm coming up.
Reverse is head up.
I'm coming up.
Included in the Aldrete score.
Wait, there's more than one? Okay, right on the dot.
Cheat notice?
She said she was. She said she was cheating.
Woo-hoo!
Respiration and circulation.
Baby. I got it.
At least she admitted to cheating, right? All right, Haley's still leading. Who's Haley? All right, go Haley. Surgical complication characterized by absent bowel cells, vomiting, no bowel movements, or flatus and distended abdomen.
I'm trying.
Severe post-op complication when organs protrude through the wound. Yes, evisceration.
152 more points to go, baby.
Evisceration. Y'all make sure y'all know the difference in the two, because it's an evisceration.
Oh, man.
Select all that apply.
Oh, man.
Signs of hypovolemic shock.
Yes.
Huh? Dang it.
Yes, all four of those.
I passed
Signs
you.
of hypovolemic shock.
Sorry.
The best way to evaluate patient understanding of education is you have to type it in.
Huh?
Teach back.
Teach back.
Really?
Seriously?
I put talk back.
Same difference.
Teach back, talk back. I know.
I didn't spell it right.
Lord have mercy.
It's gonna count.
I didn't spell it right at all. I don't know what I did.
Yeah, teach back.
Teach back.
Teach back.
Only one
Teach
person.
back method.
One per.
I didn't know you would put that in.
Yeah, I just put teach back. I just put teach back too.
Last one. Select all that apply. Bariatric patients have improved lung function in what positions? Yes, sideline or reverse Trendelenburg.
Come on, Zach, wait,
I
you gotta pass
still
me.
beat you.
That's crazy.
Not
Oh, did I?
Trendelenburg,
I don't know.
reverse Trendelenburg.
I'm slow to-
Heads up.
My bad.
Okay, let's do who won.
Not me.
Haley, sure.
You teach back.
Told you I didn't spell it right.
It's gonna be forever when I say that.
Oh, there's two Haleys in here.
Haley 1 and Haley 2.
Okay. All right, was, what kind of learning or knowledge was it? It was just understanding, right? It was an application, which is what most of your test questions are, application. But you have to know the information first to be able to apply it. So that's why, most of the time, Kahoots are gonna be just understanding, knowledge, testing questions. But if you can answer these questions, then you should be able to apply that knowledge when you get your test, okay? Do you have any questions before we're done?